My name is Bethany Johnson. Today's date is August 12th, 2021, and today is Thursday. Today I'm going to be discussing the female reproductive system, and I'm going to be showing some images courtesy of Visible Body that I have personally dissected to kind of zoom in on the selected pieces that we are to show. Towards the end of this presentation, I will be sharing with you a common disease often contributed with the female reproductive system. So to get started, I will start showing the images. In this first image is an image of the vagina. So you can see that I have highlighted this blue because I feel sometimes when I make these videos, I get like a lot of like glassy appearance that I can kind of see. I don't know if that's from that light that's shining above or maybe from the window shining through, but I like to highlight these so you can kind of see a little bit better actually what I'm trying to show you and present to you. So the vagina, you can kind of see a little bit of the vagina that's kind of offset in the back. A nice close-up picture of the uterus here. The uterus. We have the external female genitalia, otherwise known as the vulva, right here, all this blue right here. And of course, all of the female reproductive organs are all in the posterior portion of the pelvic area. We have a fimbriae. That this is the left fimbriae, and this is the closest part of where the uterine tube or the fallopian tube, whatever you want to call that, is actually attaching and sitting upon the ovary itself. So the fimbriae. And then again, the right fimbriae is actually, it looks a little bit more close up. So you can see how that kind of just, almost like finger-like projections that kind of just lay right on top of the ovary itself. And here's a nice picture of the left ovary again. And then a little bit of a closer image of the right. And I like this image a lot. When I dissected this, I kind of zoomed in on it before I printed it off because I feel like you can see a lot of the kind of the finger-like projections on the fimbriae, which is really cool that you can see how that is. And then how I have been referring to either the fallopian tube or the uterine tube. This is it, highlighted in blue. And of course this is the left one anatomically. And then we have the right uterine tube or fallopian tube here. And you can kind of see how that both of those connect equally right into the uterus itself. So now I'm going to be sharing with you a common disease that can often be contributed, and I have chose to discuss endometriosis. Endometriosis actually happens when the endometrium, which is actually the tissue that lines the inside of the uterus, is actually outside of the uterus itself. So not good, obviously. That's not how it's supposed to be when the endometrium is not supposed to be like that. Endometriosis, sorry, I cannot talk today. Endometriosis mostly happens in the posterior abdomen or pelvis, and posterior would obviously mean lower. And the symptoms of endometriosis would be like lower abdominal pain, any type of pain with menstruational periods, or in the medical field we called menses. Pain with sexual intercourse with your partner, and definitely one that is really sad to hear is that many females end up having extreme difficulty getting pregnant, which we would call infertility. So a fun fact that I actually learned, or I don't know how fun it is, but a fun fact for me, I guess, being in the medical field, is that approximately 10% of reproductive age women actually have endometriosis. And even though it's a low percent, you can see how that can actually it affects more reproductive aged women rather than young girls that before they would actually have their period. But it actually is seen in up to half of young girls and teens that have actually had their period that have pelvic pain and painful periods. So about half of young girls and teens that have actually had their female menstruation that has already happened, if they have a lot of pelvic pain and painful periods, chances are 50% of them probably have some form of endometriosis. So obviously the quicker that they can actually get the treatment for that, the better, especially as they get older in more of the childbearing years, when they're able to conceive with their partner, to be able to try to get that on the mend before that happens, or they're ready to have children of their own. The exact cause of endometriosis is still unknown, but there's actually several theories behind it. I'm going to share with you two of those theories. One of them is retrograde menstruation, and that is actually where the blood and the tissue from a woman's uterus actually travels through the fallopian tube into the abdominal canal, or abdominal cavity, during her period. I definitely found it really interesting. A second, my computer is going to shut off. Okay, there we go. I had to charge it. Sorry. I forgot where I was left off. So it travels through the fallopian tube into the abdominal cavity. So during her period. So I mean, obviously, if you have any type of retrograde menstruation, I can definitely see that you would definitely have a lot of pain and definitely be symptomatic of that, because the blood and the tissue that's shedding is actually going into your abdominal cavity, not exiting out your vagina as it should. I definitely found it really interesting that nearly all women, including myself, have some type of retrograde of menstruation, but only a few of those women only happen to get endometriosis, so that's the good thing. Another theory that I learned when I was researching this topic is colemic metaplasia, I believe is how it's pronounced from when I researched it. And that actually happens when the cells in the body outside of the uterus actually undergo changes and become cells that line the uterus, I believe is what it is. So endometriosis is definitely a lot more common if a close relative or a really close friend actually has the disease. And that was actually really interesting to me, because I know, if females, if a lot of females, work together, or you are always together, your menstrual cycles kind of seem to combine, and you start getting your menstruations during the same time. And so I kind of felt like that maybe could be a contributing cause, and I could see that might be a contributing cause possibly for endometriosis. So again, just a theory, but it has been seen that it possibly could have some type of genes could potentially be influencing endometriosis. When a woman has endometriosis and on her period, she's actually bleeding from both the cells and the tissue inside the uterus, and also from the cells and the tissue outside of the uterus. When it's outside of the uterus and the blood actually touches other organs inside the abdomen, it can cause lots of inflammation and lots of irritation, creating extreme pain. Again, another reason why you would want to probably use some type of pain medication, and knowing that something is not right because of that it's not flowing out of the vagina as it should. Lots of scar tissue ends up building up from all of the inflammation and all of the irritation. About 20 to 40%, I believe, of women with infertility have some type of relation or have a diagnosis of endometriosis. So I found that extremely terrible to hear, but very interesting that endometriosis is so closely linked with infertility at being 20 to 40%. So definitely one of the biggest reasons during a woman in childbearing years to be able to get that assessed, diagnosed as quickly as possible to get you on the road to healing and hopefully able to remove that scar tissue. And I'm going to get to that in just a few minutes towards the end with the surgical aspect of that. But what endometriosis does, what does it do to the body? So I've talked about what it is, the symptoms of it, but what is it actually doing? Like, what's the lasting effects that can actually happen with endometriosis? So it can actually cause a lot of distortion. When I mean distortion, it creates distortion, which is not the way that our body was made. It's kind of making it look different, especially with the scar tissue. It's distorting your organs. It's distorting the fallopian tubes, so they're actually unable to pick up the egg after ovulation with the fimbriae, which obviously would contribute to infertility if your fallopian tube or your uterine tube is not doing what it's supposed to do within the reproductive system. And it also creates inflammation that can definitely affect the function of everything: the eggs, the ovary, the fallopian tubes, the uterus in general. Some physicians may treat endometriosis with some type of anti or non-steroidal medication like Motrin, Aleve, ibuprofen, and then and see if that ends up helping. But the only true way to actually diagnose endometriosis is with a laparoscope, and what the surgical team would actually do under sterile precautions would they would look into the abdomen with like a little camera through the belly button within the abdomen, and they would visually be able to see if there's any type of endometriosis lesions. And then at that time, if they are needing to, they can take a biopsy of that to be able to rule out if that is actually, a tumor or an endometriosis lesion itself. The endometriosis lesions can vary in size and also appearance. A really fun fact, or what I thought was a fun fact as well, is that endometrioma is actually the term for endometriosis within the ovary. And scientists have actually nicknamed that the chocolate cyst because of the material, or kind of like the gunk that we would see inside of the cyst actually looks like chocolate syrup. So for me, being in the medical field, I thought that was definitely really interesting because who doesn't like chocolate? But of course, in the medical aspect, if you were to see some type of chocolate syrup type of material inside of a cyst within the ovary, you knew that that's not normal, and now we would know that that's probably some type of endometriosis within the ovary itself. The easiest part of medications, like I said, the doctors would normally prescribe some type of non-steroidal medication, again, like Motrin, Aleve, ibuprofen, and then also any type of female hormone therapy to help her hormones. A lot of women take contraceptive therapy in general, just to help with their menstruations, sometimes to help with their mood swings. And in this case, it can actually help with endometriosis itself. So oral contraceptives, which we would say PO in the medical field, if taking a medication by mouth is not for you, there's also transdermal ones, which would stay on for a week, 7 days. And then there's also, they also have shots, and then they also have internal ones that would sit right up by your inside of you. So that is a couple different types of female contraceptives that would be hormone related. They slowly give you hormones of estrogen and progesterone. And then there is surgery, of course, in all diseases and disorders. Surgery is typically always the last cause, but it's also a way to diagnose endometriosis officially, as well as help. So what do I mean by help? Well, it actually can remove a large amount of scar tissue. So if there is a woman that is in extreme pain and not able to have wellness within her everyday life, isn't able to be at her best quality of life, surgery is probably the right route. But again, the medical team and the physicians for that woman would be able to make that choice, as well as her what is best for her and her life. What they would actually do, again, is they would remove the scar tissue. They would kind of burn all of that out and remove any type of endometriosis lesions. Having surgery to remove any type of scar tissue can greatly reduce a lot of the pain and aggravation that the woman is feeling all the time. And they can actually relocate a little bit of the fallopian tubes and the ovaries to kind of offset them a little bit within the position of the pelvis. And with doing this and removing a lot of that scar tissue can greatly help a woman not have so much infertility issues. So having surgery within the reproductive years can greatly increase the chances of being able to get pregnant, and I thought that that was amazing. So some women might actually be more apt to have that surgery in hopes that they might one day be able to conceive when they are ready to. So I hope you enjoyed this presentation. Thank you very much.